Hi, my name is Logan McCulloch, and this is my introductory video explaining why I'm taking a leap of faith and selling my home, quitting my job, selling most of my possessions, packing up, and trying to through hike the 2,200 mile Appalachian Trail. I'm hiking it from north to south starting in July, from Maine down to Georgia. It's actually one of my kind of lifelong bucket list dreams. I did a large section of the AT back in 2003 up in Vermont when I through hiked the Long Trail, about 100 miles of which is actually a part of the Appalachian Trail, and I met a number of Appalachian Trail through hikers that were about 1,500 miles into their trek. I have hiked sections of the AT in most of the 14 states that it passes through, and had always wanted to take the opportunity to do the whole thing, take a shot at it. So why now? Well, something that wasn't on my bucket list was contracting Lyme disease, which I caught in May of 2011 on a backpacking trip to Mammoth Cave National Park with my son Gabe. Hey Gabe, and my dog Cuz. We were doing it for Gabe's graduation present, going skydiving at a velodrome close to Mammoth Cave, and decided to go down there and do an overnighter. I woke up the first morning to find about 20 deer tick nymphs, very, very tiny, poppy seed size, nymphal ticks, attached from my waist all the way down to between my toes. I didn't think a whole lot of it because I'd had ticks many times through the years. I thought I was well educated to preventing diseases. I believed what I now know are myths, like if you get the ticks off of you properly within 24 to 36 hours, there's virtually no chance of contracting Lyme disease. I now know that's not true. I got these ticks off in less than 10 hours because we had just come in the night before. But later that summer, I started to develop symptoms that only later did I realize were related to Lyme disease, symptoms that weren't so popularized in public information. I was working out very hard. I was an athlete, competitive cyclist. My son had talked me into doing the P90X 90-day fitness routine, and I kind of sloughed off some joint pains and aches and fatigue to the exercises I was doing. By late summer, they had gotten so bad that I finally went and saw my physical therapist, thinking I had re-injured some old injuries. He worked on me for 2 weeks in early September, and he's the one, thanks Chuck Clark, Physiotherapy Associates, who actually first tossed out the idea that I might have an underlying condition that was preventing me from making progress with physical therapy. And he started listing off several of them: lupus, fibromyalgia, chronic fatigue. And when he said Lyme disease, the light bulb finally went off for me, and I remembered those tick bites. And I sat down and wrote out a medical history from my athletic training log where I had noted all those symptoms one at a time. I had joint pains, asymmetrical ones, one wrist, one elbow, one knee, one shoulder. Very common, I found out. My ankles, my toes, my fingers, my neck would pop so bad from the infection that was growing there. Lyme loves your joints. It loves collagen tissue. It loves it because it can hide there, and it can avoid the antibiotics that are in your bloodstream if you are being treated for Lyme. It's really important to get treated early while the spirochetal bacteria, it looks like a little corkscrew under a microscope, is still in your blood where the medicine can reach you easily and reach it easily. Once it burrows its way into your organs, your joints, basically anywhere it wants to go, it's much harder to treat later on. I ultimately went 5 months without getting an accurate diagnosis. I experienced visiting my doctor, who used a lab test that I since found out was only good for confirming a Lyme diagnosis that's properly done through a clinical examination with a patient history and symptom checklist. It's only used to confirm a diagnosis because the Western blot can have as much as a 40 to 50% false negative rate. It only tests for the antibodies that your immune system produces that are specific to the Borrelia burgdorferi bacteria that causes Lyme. If your immune system's suppressed, and Lyme does that, it's a master of hiding and suppression of your immune system so it can survive, you may not produce the antibodies that produce a positive Western blot test. So my doctor, in his level of knowledge at that time about Lyme disease, didn't think I had Lyme because according to the common literature, the Western blot was negative. I didn't have Lyme, but I continued to get worse. By October, I had a hard time driving back and forth to work because I would get lost some days. I would get disoriented. I was losing people's names that I'd known for 20 years. I couldn't finish sentences. My short-term memory was awful. I was confused most of the time. I couldn't remember how to do basic tasks. I would have a hard time communicating verbally or in writing. And ultimately, I wound up seeking out a Lyme specialist through some Lyme Warrior resources on the internet. Unfortunately, I had to travel out of state because there are no specialists in the state of Kentucky. It's not uncommon. Most Lyme patients have to travel as many as 6-8 hours or more to reach a specialist. I did get properly diagnosed in November, 5 months later. We redid the Western blot, sent it to a tick-borne disease specialty lab who basically does nothing but do lab tests to try and determine a variety of tick-borne diseases because there's far more than one. Lyme is just the most well-known. Ultimately found out I did have Lyme. I also had a co-infection called Bartonella, and we had to treat for both of them. 7 months later, after intense antibiotic therapy and a lot of other therapies to try and build my immune system back up, I took a medical leave from my job at the American Red Cross. I did make progress. This past summer of 2012, I started to see some light at the end of the tunnel. My legs, my lungs, my heart seemed to be working again. I could get up off the couch. I could walk the dog and not want to collapse for 2 days afterwards. I actually started exercising again, and this idea of through hiking the Appalachian Trail came back to me. Except now I want to do it for a reason. Beyond just it's just something that I love and I want to do personally. I want to make it a 1 + 1 = 3. I want to try to raise Lyme awareness and help people prevent the disease, help people intervene quickly if you are bitten by a tick, help people become educated to be their own health advocate, and make sure people don't have to deal with what I've dealt with, what the 50+ people I've met through my own local Lyme support group that just started in October of 2011, a month before I was diagnosed, and already has 54 members. I want to help people learn how to prevent this disease and not learn from experience for yourself or those you love. The fastest growing segment of the population that's catching Lyme are kids under 10 years of age. Who else is out running through the fields and romping in the backyard and playing in the woods? You know, it's something to take serious because these ticks can survive just about any part of the United States. So in July, I'm lacing up my shoes, hitting the trail. I'll be doing videos on a regular basis. They'll be shorter than this, 4 or 5 minutes from the trail. I'll try to do a couple, 3 of those every week and upload them once a week when I hit small towns along the way to resupply and clean up and take a break. 2,000 miles, 6 months, hope to finish in December down in Springer Mountain, Georgia. I hope you'll come along. I hope you'll subscribe to my channel. I hope you'll share it with others. I hope you'll share this information. We'll do some Lyme tips of the day. We'll bust some myths. We'll reinforce some key facts. It won't all be about Lyme, but I'll definitely have that as a part of every video. But you'll get to meet and experience what it's like on the Appalachian Trail, which is an incredible, incredible national resource. And a lot of really incredible people out hiking it for a day hike, for a week, and yeah, even for 6 months. My online journal you can access at our local Lyme support group, www.kentucky-indiana-lymesupport.org. You can also find it on trailjournals.com under Journey Through Lyme. My trail name is Unitic. Took that trail name 10 years ago for a different reason, but it sure seems prophetic. And I'm going to keep it now because it only takes one tick to change your life. And we don't want that to happen to any of you watching this or anybody you can share this information with. Thanks for your time today. And remember, ticks bite, Lyme sucks. Don't let it happen to you. And join me on the trail. That's all for today. Thanks.